Assalamu alaikum, welcome to Medical Corner. Today, our topic of discussion is isometric muscle testing. Resisted isometric muscle testing is basically clinically useful technique which is used to detect the neuromuscular dysfunction or the problem which is originating from the muscles. Now question arises why we perform this technique. We perform this technique to differentiate either the symptoms are arising from the inert or the contractile tissue. Now the question arises what are the inert tissues? Inner tissues or structures are ligaments, capsule and bursas. And contractile tissues are muscles and tendons. So, resisted isometric muscle testing technique is used to check the dysfunction in muscle or the tendons. So, if the symptoms are produced during the resisted isometric muscle testing, so it's mean these symptoms suggest that the problem is coming from the muscle or the tendons or the contractile tissue. So, there are the six possible responses to isometric muscle testing, which is explained by James Sirix. First of all, you should have to know about during performing this test on the patient, what will you assess? There are the two things. The first one is pain, and the second one is the contractions in the muscle. Patient will tell you about the pain, but patient will now tell you about the contractions in the muscle. A therapist or the doctor should be very attentive to assess whether the contractions in the muscles are weak or the strong. So, the first response is strong and painless. If the patient is not complaining any pain and during the assessment the contractions in the muscles is also strong, so it's mean there is no lesion in the muscle or the tendon and the muscle is normal. Response is strong and painful. Let me give you an example. In the lateral epicondylitis, when you perform passively resisted extension of the wrist, the patient will complain pain at the lateral side of the elbow at the level of the lateral epicondyle, but contraction in the extensor muscles are strong. So it's mean there is the minor lesion in the tendon of the extensors of the wrist. So the response is painful and strong contractions. During the testing, if the response is weak and painless, it's mean there is the complete rupture of muscle or the tendon. Always remember that if there is the complete ruptures of the fiber of ligaments or complete ruptures of the fiber of muscles, tendon or the nerves, there will be no pain. So in this case, when there is complete rupture of muscles or tendon, the patient will not complain any pain, and on assessment the contraction in the muscle are very weak. And next one is if the patient complain pain and on assessment there is the weak contractions in the testing muscle, it will suggest you that there is a gross lesion in the muscle or the tendon. And its example is fracture of patella. I'm going to explain how the fracture of patella will leads to the gross lesion in the tendon or the muscle. Look at this picture. The patellar tendon is passing anteriorly to the patella. So whenever there will be the fracture of patella, The ganglion in the tendon, which is passing anteriorly from the patella, the ganglion will be occur in this tendon. So the response will be weak and painful. And the fifth one is painful on repetition. It will suggest that the patient is suffering from the intermittent claudication. What is the claudication? Basically, it is a severe pain in the buttock, thigh region, and the calf region due to the arterial insufficiency. So, this type of patient will complain you the pain on repetition. And the last one is the painful in all the movement. It's mean that the patient is a candidate of the emotional hypersensitivity. The patient is very hypersensitive. That's why in all the movement, he or she is complaining the pain. Now, how to perform this resisted isometric muscle testing? The first one is the joint should be in the mid range. Why in the mid range? Why not in the initial ranges or the end ranges of the movement? Because in the middle of the range, maximum work is done by muscle. So, in this range, when you perform the isometric muscle testing, the symptoms are originated from the muscle. Other structures will not be involved. So, your result will not affect. And the next point is muscle other than the testing muscle must not be included. If other muscles are included, then your result will affect. So, for example, if you're assessing the shoulder joint movements, then the back of the patient should be erect. If other muscles are involved, then your result will be effect. So, next one is the patient must be instructed to exert maximal effort. If the patient will not exert his maximal effort, for example, during if when you will resist the movement, and the patient will not resist it with his full force, then the contractions in the muscle will not be assessed. So might be possible contractions are normal, but you are labeling that there is the weak contraction in the muscle and the patient is suffering from the gross lean in the muscle, right? So instruct the patient to exert maximal effort, and therapists should be attentive to identify pain and weakness in the muscle. And the whole time of the resistance is at least 5 seconds, in which you will resist the movement of the patient, and patient will exert his maximum effort to resist your force. Okay, let me give you an example of the shoulder resisted isometrics. Resisted isometric muscle testing is very easy to perform. Just perform the function of the muscle and resist this movement. For example, if you want to assess the flexors of the shoulder joint, then instruct the patient to flex his arm in the mid range. Always remember in the mid range, and the doctor will resist the movement. This arrow shows you. And the patient will exert his maximum force to perform the movement. And then ask the patient about the pain and assess the contractions of the muscle. Let's suppose the patient is complaining the pain, and on assessment, there is the weak contractions in the flexor muscle. It's mean there is the gross lean in the flexors of the shoulder joint. And the second example is if you want to assess the abductors of the shoulder joint, then simply instruct the patient to abduct his arm in the mid range, and the therapist will resist the movement. This arrow shows you resist the movement, and the patient will exert his maximum effort to perform this movement. and let's suppose the patient is complaining you that there is no pain during the movement, and on assessment there is strong contraction in the muscle. It's mean there is no lesion in the abductors, and abductors are normal. So I hope guys, after watching this video, you'll develop a good concept about isometric muscle testing. So like and share my video and subscribe my channel. Thank you very much.